The prison pipeline, from street to cell. For the individual struggling with fentanyl addiction on the streets of Kensington, the nearest stable address isn't a treatment center. It's the Philadelphia County Jail System. Year after year, police sweeps lead to thousands of arrests for low-level, self-sustaining offenses. Public drug use, loitering, petty theft. This relentless cycle is not a form of justice or rehabilitation. It is a brutal, expensive, and utterly ineffective system designed merely to manage the crisis, not solve it. We are not just witnessing addiction. We are documenting the largest, most costly public health failure in the city's budget, the systematic criminalization of disease. The law sees a criminal. The reality is a patient suffering from a chronic, complex illness that cannot be cured by incarceration. The fiscal absurdity, cost of containment. The cost of maintaining this revolving door is fiscally absurd. The average annual cost to incarcerate one individual in Philadelphia is estimated to be over $40,000 to $50,000, often far exceeding the annual cost of comprehensive community-based addiction treatment and supportive housing, which can be provided for under $15,000 to $20,000 per person. The system is actively choosing the most expensive, least effective option. This vast expenditure of public funds achieves nothing but a brief, temporary removal of the problem from public view, only for the individual to be returned to the exact circumstances, the same street corner, the same drug dealer, the same despair that led to their arrest in the first place. This financial hemorrhaging is a key component of the uncomfortable truth about how cities prioritize managing the optics of poverty over fundamentally solving its root causes. The jail, as the largest psychiatric ward, the incarceration system has become the largest, most under-resourced mental health facility in the nation. In the absence of adequate funding for community-based psychiatric care, the mentally ill and the addicted are inevitably funneled into jails. They enter the facility requiring immediate, complex medical and psychiatric care, but are often met with overcrowding, staff shortages, and insufficient resources to manage severe withdrawal, detoxification, and co-occurring mental health disorders. The promise of mandatory treatment within the correctional facility is frequently broken, replaced instead by short-term crisis stabilization and mandatory medication that only addresses acute symptoms, not the chronic disease. This moral failure means the state is using a punitive facility to handle a clinical population. The fatal overdose upon release. The most tragic consequence of the revolving door is the catastrophic increase in overdose mortality immediately following release. During incarceration, an individual's tolerance to fentanyl and other opioids dramatically decreases. Upon returning to the streets of Kensington, they often resume using the drug at the same high dosage they used before being arrested, a dosage their newly lowered tolerance cannot withstand. Statistics are chillingly clear. The rate of fatal overdose is up to 129 times higher in the 2 weeks immediately following release from jail or prison compared to the general population. The very act of incarceration, intended to protect society, often becomes a delayed death sentence for the addicted individual. The system, by removing them from the lethal supply for a short period, sets them up for a near certain fatal relapse. This mechanism must be considered a public health disaster directly manufactured by the criminal justice system. The mandate for diversion, the health court model. The data demands a radical shift, a comprehensive commitment to diversion, moving the addicted individual out of the criminal justice system and into a judicially supervised, medically driven treatment program. Philadelphia has pioneered models such as the Kensington Health Court, designed specifically to handle low-level, non-violent offenses related to addiction. The fundamental premise is simple. Addiction is a chronic disease requiring treatment, not punishment. These specialized courts mandate treatment, provide supportive services, and offer housing assistance, using the authority of the judge not to incarcerate, but to ensure compliance with medical protocols. Cost effectiveness and the return on investment. The argument for diversion is not just moral, it is overwhelmingly financial. Studies consistently prove that treatment is significantly more cost-effective than incarceration. Every dollar invested in high-quality treatment programs yields multiple dollars in savings by reducing crime, lowering healthcare costs associated with drug use, and preventing the financial drain of repeated arrests and trials. Furthermore, successful diversion increases the rate of workforce participation and the tax base, transforming former liabilities into productive citizens. The failure of the system is the refusal to accept this evidence and reallocate funds from the massive, failing correctional budgets towards scalable public health infrastructure. The reluctance to build these treatment centers is a direct reflection of a political choice to prioritize the punitive model over the restorative one. The ethical imperative beyond the revolving door. The continued use of the jail system as the primary response to the fentanyl crisis constitutes an egregious moral and ethical failure. It traps individuals in a vicious, self-perpetuating cycle of despair, guaranteeing their continued suffering and maximizing the cost to taxpayers. The comfortable truth that politicians prefer to deny is that the problem in Kensington is not a failure of individual morality, but a total breakdown of the social contract. Until cities recognize that incarceration is a penalty for crime, not a cure for disease, the streets of Philadelphia will continue to suffer this devastating and predictable cycle. The moral solution requires political courage, the immediate, strategic closure of the addiction to jail pipeline, and the reallocation of the massive correctional budget towards medical solutions that actually offer recovery. Final call to action. The choice is clear. Continue to pay the maximum price for minimum results, or invest in solutions that heal individuals, restore communities, and save taxpayer money. This is America's crisis of conscience. Share this documentary to expose the failure of the costly jail-to-street pipeline. Subscribe to America's Uncomfortable Truth as we continue to investigate the systemic flaws that drain our cities of both resources and human life.